National Hospital Week is celebrated during the month of May, and many hospitals in rural areas on the neighbor islands are essential in providing emergency services in those regions. But these facilities have faced their share of challenges. Alan McPhee, CEO of Kahuku Medical Center, is here tonight. Let's send things over to Bridget. Bridge?
We have a special guest with us tonight. It's Alan McPhee, CEO of Kahuku Medical Center. Alan, thank you for joining us.
My pleasure. Thank you for having me.
So obviously, when it comes to living on an island, we live on an island. But it still takes a while to get around, I would say, especially where folks on the Kahuku side live. I want to talk about the importance of rural hospitals and neighbor island hospitals.
Well, for any rural hospital, especially here in Kahuku, as well as the other neighboring islands, the critical thing is being able to offer emergent and urgent care to your local residents. Trying to drive for an hour, and if there's traffic, hour and a half, could be life-threatening.
Absolutely.
So it's critical that we have that level of care close at hand. We also want to be able to offer the community the services that they need, so that they don't have to drive an hour to get checkup with an orthopedic surgeon or with a cardiologist. We want to be able to offer those services to the extent we can locally.
Absolutely, Ellen. And for myself, speaking as a townie here, I didn't really realize, to be quite frank, that there was a Kahuku Medical Center, but you guys get hundreds of visits to the emergency room every year.
We do over 6,000 emergency room visits a year. We're closer to 7,000 emergency visits.
Oh, thousands, not hundreds.
Yeah.
Kahuku Medical Center, it has had its share of challenges though, Alan. Last year in particular, the hospital celebrated its 10-year anniversary in restructuring to continue operating. Tell us about those challenges.
The hospital went through a stretch of poor financial performance. So they ended up having to declare bankruptcy. The state and the Hawaii Healthcare Services Corporation, which is a wholly owned company of the state, came in, took over the hospital. And so it's been, at that point, 10 years since we restructured under them. We're doing well. We're not great, but we are doing well. We've had a couple of profitable months. And so we see this as a good and continuing trend as we try to expand services to the community. We do a lot with public relations and marketing, making sure that we're offering the services, one that the community needs, and in a manner that they're happy with, so they're glad to come to us.
Well, and certainly when it comes to a hospital, people tend to think of a very sterile building where they can receive help, but people don't often realize that when it comes to hospitals, rural hospitals in particular, finances are huge in terms of just keeping this going and making sure it provides the service to the public, to the community, especially in a rural community.
Financing is critical. Fortunately, we have some money that we're able to get from the state for construction purposes, but it's also in the local community there. It's we have our vision statement is friends and family, taking care of friends and family, because it truly is. The people know and or are related to many of our patients that come in, and that type of care spills over into everybody else. So nobody's a stranger, they're all a friend or family.
Are there any future plans for Kahuku Medical Center?
Yes, we've just added mammography. That's just brought that back up again. It's been closed down for about 13 years. We are in the process of designing and remodeling one of our old buildings for a medical office building so that we can bring in cardiologists, orthopedics, OBGYN, any other specialists that we think would work out well. So that with the whole idea that we can start doing then not only seeing those physicians, but we can be doing their procedures there as well. So they don't have to drive an hour for a mammography, wait in line, find a place to park, and then an hour drive back home. So it's bringing them the in-town services, because we would be recruiting doctors from town to come up there and work maybe half a day a month to 2 days a week, whatever their volume is, and this could be volume driven.
Alan McPhee, CEO of Kahuku Medical Center, thank you for joining us tonight.
Thank you, Bridget. Nice seeing you.
Over to you.
Right on. A critical